consent?
I give consent to be on video. My name is Nicholas Rivnak.
Okay. So first I would begin by washing my hands, introducing myself by saying, hello, my name is Adrian, and I will be your nurse today. I'd ask two identifying questions such as full name and date of birth. I would provide privacy, tell the patient what I would be doing, which is an assessment, and then I would apply my gloves. So do you have a history of COPD?
No.
Do you have asthma?
No.
Patient is alert and orientated. He was making eye contact with me. What is your full name?
Nicholas Rivnak.
Where are you at?
Your room.
What time is it?
About 1 o'clock.
And why are you here?
For an assessment.
So patient is alert times 4. He answered all my questions correctly. How are you feeling?
Good.
Do you have any problems or concerns?
No.
So patient's mood and behavior is appropriate. His appearance is appropriate for the season, and he answered my questions correctly. His speech was clear and articulate. So now I will begin by doing the head and face assessment. So his eyes are symmetrical, his nose is midline, and his ears are symmetrical. You can tell because the corner of his eye aligns with the ear. His face is a palish tan. He has no lesions. It's evenly distributed, the color. No jaundice, no redness, no lesions again. And now I will assess the hair. So hair is clean, it's dry, there's no lesions, he's well groomed, no parasites, and it's evenly distributed. There's no areas of balding. Now I will test your eyes. So can you pull down your sclera for me? Your eyelids for me. Sclera is white with no redness. Conjunctiva is pink and clear with no drainage. Okay, next I will have you watch the tip of my pen light as I move it in positions. Just watch with your eyes and not your head. Okay? Okay, so eyes move symmetrically and smoothly. There's no signs of nystagmus. Next I will measure the pupils. So pupils are round and they were about 4 millimeters each, right and left. So next I will do reactivity to light. So I will have you look at the wall behind me over my shoulder as I shine the light in your eye. So left pupil constricted. And right pupil constricted. Now I will do indirect light. So again, just look over my shoulder at the wall. I will shine the light in the left eye and see if the right eye pupil constricts. Okay, and both pupils constricted with indirect light. Next, I will test for accommodation. Again, just watch the tip of my pen light as I move it closer with your eyes and not your head. Okay, so eyes converged and pupils constricted. So pupils were equal, round, reactive to indirect light and direct light and accommodation. Next I will do neck. Can I palpate your neck?
Yes.
Okay, so I will first inspect and I do not see any lesions or enlarged lymph nodes or any redness. I'm going to palpate. So trachea is midline. And again, there is no enlarged lymph nodes or lesions. Next, I will look at your mouth. So lips are pink, they're not cracked, they are moist with no lesions. Can you open your mouth for me, please? So all teeth are intact, they are white, and there's no concerns for any dental work at this time. And do you have dentures?
No.
So these are the patient's real teeth. Okay, so I'll have you stick out your tongue for me again. So throat is pink and moist with no lesions, no drainage. The tongue is pink and moist with no lesions or drainage. I'm going to lift up your tongue. And under the tongue is pink and moist with no lesions, no drainage, and the frenulum is midline. Do you have your tonsils?
Yes.
Okay, so I'm going to have you stick your tongue out and say ah.
Ah.
So tonsils were not touching. They were pink and there was no exudate or drainage, and I would grade them a 1. And there was no odors while doing this assessment. Next, the patient is sitting up straight and erect. He's using his diaphragm to inhale and exhale, not using any accessory muscles such as the trapezius or sternocleidomastoid. And he is breathing room air with no additional oxygen source. So next I will have you take off your shirt. I will be doing the posterior thorax. And face that way for me, please. So spine is midline, it's straight and there's no curvatures. Next I will do a chest expansion and I will have you take a deep breath and exhale. Okay, inhale. Okay, so chest expansion was equal and symmetric. So now I will be listening to 10 positions on your posterior thorax. So I will have you inhale and exhale. I'll tell you to. So scapula. Inhale. Inhale. Exhale. Inhale. Deep breath. Okay, another deep breath, please. Deep breath. Now listen to over here. I'm going to have you lift up your arm a little bit. Okay, inhale. And then right here. Deep breath. Okay. So anterior or posterior thorax sounds were clear bilaterally through all 10 positions, and there was no crackling. Next, I will have you turn around and I will do the same for the anterior thorax. So again, as I move along, just take a deep breath. Deep breath. Deep breath. Deep breath. Alrighty, I'm going to have you lift up your arm again. I'm going to listen over here. Okay, and one last time. Deep breath for me. Okay, so anterior lung sounds were clear bilaterally through all 10 positions. There was no crackling. Next, I will have you lay down on the bed and I will assess the abdomen. Okay, so I would drape the patient's chest and legs so I can see all 4 quadrants. Okay, so the abdomen is a tannish, beige color. There's no primary, secondary, or vascular lesions. The umbilicus is midline, making the 4 quadrants equal. There's no drainage or redness in the umbilicus, and it is recessed. Look. Contour is flat, non-distended, and there was no pulsations. Do you have any pain in your abdomen?
No.
So if he had pain in his abdomen, I would inspect that quadrant last. But since he doesn't, I will auscultate the right lower quadrant first. So I'm going to listen. I'm going to pull these down a little bit. pull this side down a little bit. Okay, so I heard intermittent clicking and gurgling through all 4 quadrants at a frequency of 8 to 10. Okay, and that is a sign of active bowel sounds. Next, I will pulsate. Do you have any pain or tenderness?
No.
Okay, so I'll start down here. I'm going to move. Let me know if you have any pain. Any pain? Okay. Okay, so patient stated that he had no pain or tenderness while palpating the abdomen. There was no guarding, no distension, and abdomen was soft and not rigid. Alrighty. Now I'll have you sit up, please. And I will percuss the kidneys. So face that way, or you can come over here. Go back over here. Let me know if you have any pain or tenderness. Any pain?
No.
Any pain?
No.
So patient stated that he had no pain or tenderness while I percussed his kidneys. Lastly, I would close by making sure that the patient is in comfort, making sure that items and call light are in reach, and I would document any findings and make sure the rails are up ×2.